Hi there, I am Dr. Zakir Hussain, Senior ENT Consultant. In this video clip, we are going to discuss about ear wax. In short, about anatomy. The external ear is a part which is only lined with skin. This skin has got two types of glands. One is luminous glands and second one is pilosebaceous glands. At this point, if you ask me what is ear wax, I will say it's a collection of secretion from both these glands along with old dead skin from the external ear along with the dust particles. All this constitutes the ear wax. See, at this point, let me tell you the difference between the skin in the body and in the ear. In the body, the skin is normally replaced every 27 to 30 days. And the replacement is from below outwards, upwards. But in the ear, it is not like that. The ear, it starts from the tympanic membrane or eardrum and it slowly migrates out. So it is from inside out, it's been rejected. The old skin comes and drops down here, outside. So in short, it's a self-cleaning mechanism. Note this point. I will come to this point once again, later on. So what are the functions of the ear? The first most important function, it rejects all the dust particles. Second one, it has got an acidic nature. Being acidic in nature, it is antibacterial and antifungal and antiviral. Third is little oily, it's a lubricant. It makes the skin there little soft. And the last one, it contains lysozymes and immunoglobulins, which has got antibacterial and protective, antibacterial, antiviral and protective in nature. So, next, what are the types of wax? It depends upon the consistency and the color. Depending on the color, it can be brown wax or it can be little yellowish wax. On the consistency, it can be hard wax or it can be soft wax. What are the reasons of overproduction? Some of the patients, they come and say, doctor, I need to clean it every 3 months, every 6 months. Some of them, they have more wax production. That's what they say then. Why is it so? What are the causes for that? So, either it can be excess production of wax or it can be defective. The drainage is defective. Either of these two it can be. So, coming to the excess production of wax, either it can be hereditary or the person can be a type A personality, like he is hyperactive, very emotional, and these people, they have little more wax production. The last one is mechanical irritation or stimulation of the ear skin. That leads to more wax formation also. Defective drainage. You have a joint here, which is called the tympanomandibular joint. The normal movement of the joint is needed for the migration of the ear skin. But if in case the tympanomandibular joint is defective for some cause or the other, the normal movement is lost and the normal wax itself doesn't come out. It seems like the wax formation is more. So these are the causes. These are the common causes. Coming to the complaint of the patients. Most of the patients, they say we have a blocked sensation and hard of hearing. And some of them, they say there's an irritation of the ear, slight giddiness, or very rarely repeated cough. These are the common complaints. And when we examine the ear, we can see the wax, which can be occluding the ear canal or it may not be occluding the canal. So, suppose your doctor has decided, the ENT doctor has decided to clean the ear. He will give you drops, which may contain any one of these four. Usually the first one. So, you have to use the drops, 3 drops, 3 times daily for 3 days. Why is it so? To make the hard wax soft. In case it's already soft, he may go in directly for treatment, he may remove it off. In case it is hard, to make the removal easy, he will give you the drops. So I repeat, 3 drops, 3 times daily for 3 days. How are you going to apply that? You have to lie down the bed, apply drop by drop. 1 drop, give a tragal pressure. 2nd drop, give tragal pressure. 3rd drop, give a tragal pressure, so that the drop is absorbed and goes down completely, making the whole wax soft. Similarly, if you have on the other side, you have to apply it on the other side too. So after 3 days, when you go meet your ENT specialist, he is going to remove it, which can be done in 4 different techniques. The first technique is ear syringe. This is just like a water wash for a car. With warm saline, we are going to irrigate and we are going to remove the wax. The second technique is by using a hook or cuvette. Third one is by using a suction of appropriate pressure. And the last one is electrically controlled water jets, where the saline temperature, everything is monitored properly. So these are the 4 techniques of removal. So if you ask me, is it necessary to remove the wax? That depends upon the complaint. If the patient says his ear is blocked and he cannot hear, of course it has to be removed. Second one, the pain and slight giddiness, and if you feel this is a cause, again it has to be removed. And most important, the doctor feels that he has to have a look of the tympanic membrane, the eardrum, and the wax is occluding it, he cannot see it, so he has to remove it. So these are the common indications for removal. Now, I have told you 4 different techniques for removal. The first one was syringing. There are few conditions where syringing cannot be done. First condition is when there is a small perforation or hole in the eardrum or tympanic membrane. Second one, when already there is infection in the external canal, or if there is a recent history of surgery being done, or if there is any vegetable or hydroscopic foreign bodies. These are the indications, these are the contraindications for not doing it, for avoiding a syringe. Take home message at this point. Usually, it's a usual practice that after a head shower, we used to clean our ear, and with a earbud, for sure. This is not a good practice. Like I showed in the picture before, the ear is it has got a self-cleaning mechanism. You don't have to clean your ear from outside. You don't have to use earbuds or anything of that sort to clean the ear. Actually, instead of cleaning, what you're doing is you're pushing all the dirt inside. So, in this picture and the subsequent next picture, if you see, the earwax has been pushed inside and it gets completely blocked. So, the advice is, please do not use any sort of anything to clean your ears inside. You don't have to, it's a self-cleaning mechanism. So to summarize, we have seen what is wax, how it is formed, what are the signs and symptoms, and how it looks like, and how the doctor removes it. Thank you so much.
कट कर ही नहीं